Okay, now we are going to see about a case presentation on this ribs. This is an applied anatomy which we are going to see about a cervical rib. We all know that the ribs start from the first rib is starting from the manubrium. Manubrium is the part of the sternum. The first rib is starting from the manubrium and it starts from the vertebra. Which vertebra it is starting from? It is starting from the first thoracic vertebra and the last cervical vertebra. The upper superior articular facet will articulate with the last cervical vertebra and the inferior articular surface is attaching with the first thoracic vertebra. But in some cases, in some patients, they will come with the the one rib will attach with the upper cervical vertebra, that is sixth cervical vertebra. The patient will posted it with the vertebra from here. The vertebra is starting from here and there are 12 vertebrae in such cases. The vertebra starts from the sixth cervical vertebra and the inferior articular facet will attach with the thoracic vertebra. At normally, it is attaching with the rib like this. The first cervical vertebra will be the smaller. It won't attach it with the fully, but in some cases it will attach it with the sternum and it causes compression. It is the lid of the thoracic. It is called as thoracic lid. Then if it covers with the another rib, the thoracic lid may get compressed. Thoracic lid is the pathway for more veins and arteries. Mainly the brachial plexus is also emerging out from here. It is going inside here and it gives branches to here. It is the main starting point of the arteries, vessels, arteries, veins and the nerves. And some muscles will also get compressed. The localized muscles are like pectoralis, trapezius. The muscles will also get compressed. So the patient may get with the neck pain. At first, we can't assess it as a cervical rib because we are not having any X-rays or any MRIs with that case. But it is a congenital problem. The cervical rib is not a acquired problem. It is a congenital problem. By birth, they will develop slowly. They will develop the cervical rib, and it gets ossified, and the rib will get more like a bone. Like a normal rib, it will formed. Then when the pain comes, the patient comes to a physiotherapist or a doctor. They will suggest a normal neck pain exercises or IFT, the basic ones. After that, we get to know when the X-rays are done, the cervical rib is noted. I got a case like this. Around 43 years old female came with the neck pain. They suggested for traction. You heard it of the traction. The neck will getting pulled and getting locked normally. It will reduce the neck pain in normal, but not in the cervical rib cases. If you are getting pulled, the pain will increase because of the tension over the muscles over here. So the only thing we have to do in the cervical rib is a surgery. The surgical part of the cervical rib is like we can cut that cervical rib and throw it off, like a osteotomy. We will cut the rib and will throw it off. There is another clinical anatomy is there. If a rib is getting fractured, what it will cause? If a rib is getting fractured, it will pierce the lungs. If you are getting an accident and it is hitting in the chest region, the rib is getting fractured, the rib is just broken. It will pierce the inner surface of the thoracic cage. What it will come? What is the inner surface of the thoracic cage? What are the organs presented here? The lungs and the heart. Heart is in the safer side. It won't pierce the heart. But mainly it will, in most of the cases, it will pierce the lungs and the pleura. Then it may pierce the internal organs which is presented over here. Maybe a spleen, kidney or a liver. But most probably it will insert a hole or it will damage the organ like it will cause first pneumothorax, pneumothorax. The pneumothorax is the air filled in the pleural cavity. The hemothorax is in the blood filled in the pleural cavity, and the pneumothorax is the both one, the blood and as well as the airways, air. It will cause increased pressure in the pleural cavity and in the thoracic cage, and then it will cause a breathing difficulty. The hypoxia will come, you can't able to breathe, and the lungs will cannot expand beyond that limit. So it is also a main clinical anatomy of the ribs.